Good morning, good afternoon, good evening, good whatever time of day it is, wherever you are right now. Thank you for tuning in to the Conversations with Dr. Don show. The show is produced and broadcast from the Portland, Oregon area. For your first-time viewers, Conversations with Dr. Don is an ongoing series of 1-hour standalone talk shows where I interview interesting people like most of you out there, about who they are as unique, one-of-a-kind individuals, and about whatever it is we've decided to talk about. And this evening we'll be talking about the Oregon House Healthcare Committee report. The Oregon House Healthcare Committee report. And my guest for the umpteenth time is Dr. Sam Metz.
Good to be back, Don.
Good to see you again. And how many times have you been on the show now? 6 or 7 or what?
I'd have to check my punch card, Don. I'm due for a free show anytime now.
You're a delight in many, many ways, professionally and personally, and you're just fun to be with. And my work becomes easier with you as a guest.
Thank you, Don. You're a good role model. When I grow up, I want to be just like you.
Oh my God, I can't handle this. Kumbaya, you ready? All right, so we're going to be talking about the Oregon House Healthcare Committee report. And since you've been on so many times, but we have new viewers through the country and even overseas sometimes because I'm on YouTube now too. So the show is seen all over the darn place. So we'll do an abbreviated version of the bio segment, and we
Sure.
take the rest of the time for the important stuff you're dealing with here with the Oregon House Healthcare Committee report. So, if I were to ask your best friend, who is Dr. Metz?
Really?
What would your best friend say? Sam is what?
Well, I don't know what they'd say, but here's what I'd like them to say.
Okay, we'll do that.
Sam is a retired anesthesiologist who is devoting almost all of his time now to healthcare policy in Oregon. Mm-hmm. I was a charter member of the Portland chapter of Physicians for a National Health Program and a founding member of Mad as Hell Doctors. These are both local groups that advocate for universal health care in Oregon and nationally. Most of my work is writing, opinion pieces, some speaking, but primarily I produce public events on healthcare.
Yes.
And there's one coming up on the very topic we'll be discussing today, next Tuesday, January 22nd, here in Portland. Mm-hmm. Recommend viewers go to the City Club of Portland website. Universal Healthcare. They said it can't be done. And we're going to have a panel of some of my colleagues from this committee who will talk about what it did and what that committee didn't do, just as important.
So I got to be sure and watch that.
Yes.
So that sounds good. And you've been involved in this for a long, long time.
Well, about 10 years, not quite as long as you've been doing the Conversations with Dr. Don show. But I'm hoping to stick with it.
All right. So you're anticipating universal health care countrywide all over America?
Ideally, that would happen. It's unlikely, given a Congress and presidential administration that's so polarized that they can pull together. This is universal care. Getting access to health care when you need it is not a partisan topic. Doesn't matter what party you are.
Yes.
When your family needs health care, you should get it.
And that's really sad for America.
It is. We are distinctive in the industrialized world. We're the only country where you can die of a treatable condition because you don't have money for treatment.
Oh, man. So a few simple bio questions that many of the viewers have seen your answer before, but let's touch on them anyhow. And when and where were you born?
I was born in Washington, D.C. I grew up in Phoenix, Arizona, though.
Mm-hmm.
Went to medical school in Tucson, Arizona. The difference between the two is Tucson gave the world the Udall brothers and Linda Ronstadt. Phoenix gave the world Barry Goldwater and Alice Cooper.
Wait a minute now. Very good. So why were you born?
Beg your pardon?
Why were you born?
Well, I like to think it was a planned pregnancy. I'm the first of 2 children. I have a younger brother who knows nothing at all about healthcare reform except what I tell him, but he's smarter than I am and he puts things together faster than I can.
That's impossible. And anything significant worth reporting to the viewers about your racial, national, or cultural heritage? That's worth reporting.
Raised Jewish,
Mm-hmm.
and 23andMe, my brother ran the DNA genetics, and I'm 99% Ashkenazic Jewish and 1% Sardinian. We have no idea how the sardine got into the family.
I'm not at all surprised knowing you. Religious preference, you're active now in a religion?
I'm not.
Mm-hmm. And your education, you're a medical doctor?
Right.
And other education that you care to mention?
I'm a graduate of the United Systems Truck Driving School in Columbus, Indiana. And for my postgraduate work, I drove a long-haul tractor-trailer combination for Willis Shaw Frozen Express out of Boise, Idaho.
Are you serious?
I've eaten more frozen French fries than any other of my physician colleagues.
Yeah. So, and you formally retired from your medical practice at all?
Totally.
Totally.
Yes.
All right. And what are you doing in your retirement life other than all the work you're doing for healthcare?
It's a full-time job.
Full-time.
Saving the world, it doesn't provide any vacation time. You know.
Yeah, you got so much going on. I can't imagine how you manage all the things you have going on. You have a partner, a wife, a husband, a boyfriend, a girlfriend,
Yes,
a
I
pet.
I'm married to Margaret Jennings. She's an instructional designer, recently retired. Instructional designer means she designs teaching for adults, typically employees who need to comply with regulations or to correct industrial problems. She reads everything I write, and she's got this little icon that she writes on the draft that I give her. It's like a skull and crossbones. And it says, the only reason I'm reading this boring essay any further is because of our marital vows. And that means I need to go back to the keyboard and revise. I have a 19-year-old son.
Mm-hmm.
He's trans, so I've been introduced to the world of LGBTQ and youth.
Mm-hmm.
That is a stressful world for everyone, and I'm very grateful that my son has coped as well as he has. I'm also grateful that his healthcare system that took care of him has provided as much dedicated care as they have.
Yeah. Your political persuasion, are you left, right, or never been?
Yeah. Back in the 2016 presidential campaign, I took an online quiz to see which presidential candidate I aligned with most closely. And I discovered I had a 97% overlap with Bernie Sanders, which was totally shocking because he's a loudmouth left-wing nut, and I'm a normal moderate.
Way, this continues way out of whack, some kind of way.
So I try to, I do try to moderate my views so that I have a broader, more accepting audience.
You're absolutely unique. just as a human being. Yeah, and I measure my strokes because you will run away if I give you too many. Yeah. Memberships in political, social, or civic organizations, you probably lost track. There's so many of them.
Well, in fact, I'm what's known amongst political organizations as a loose cannon. Most of my work is done in collaboration with organizations, but nothing on a steady basis, other than Oregon Physicians for National Health Program.
That metaphor, a loose cannon, can you find a better one?
A cowboy, someone who operates by himself primarily.
Okay, well, I'll go with that.
Thank you.
Persons from the past or alive today that you particularly admire or look up to? Any professors or anybody else?
Person in history, probably Charles de Gaulle of France.
Charles de Gaulle.
Yes.
Why?
When France fell to the Germans, he was the most senior member of the French government. He was a junior assistant, second deputy minister of something, who left France, got to London, and said, as the senior representative of the government of France, we have not signed an armistice, and we're fighting on. He made this broadcast to the entire world from London, saying, "Free French, rally around me." And nobody did. He was alone, fighting for his nation for weeks, then months, then years. As a matter of fact, the first and for a while, the only representative of the entire French colonial empire who signed on with the Free French was Félix Éboué of the nation of Chad. He was also the only black president in the entire French Empire. And starting from that core, he rebuilt the nation of France that we have today. When he lost a key referendum in 1968, he said, "I promised I would retire if my referendum were defeated. It was defeated, so I'm retiring." And the man who saved France went with his wife to a tiny little village where he grew up in France and lived out the rest of his life on the pension of a brigadier general. This was a man who was the most powerful person in Europe, and he had 100% integrity, devoted to his cause. He never faltered, even when he didn't have a friend in the world.
And his name was?
Charles de Gaulle.
Yeah, very tall Charles de Gaulle.
Yes, with the Gallic nose, the severe look, the droopy eyes. I don't think the man ever smiled in his life.
What a recording you have of that story of Charles de Gaulle. Yeah. Mm-hmm.
Let's talk about this committee report.
All right.
There's, like, if you think the story of Charles de Gaulle was interesting, here's how this report came about. You may remember that Oregon State Representative Mitch Greenlick, chair of the House Health Care Committee, in 2017 submitted what he called the Hope Amendment to the Oregon House. If this passed, it would be an amendment to the Oregon Constitution compelling the state legislature to create a universal health care plan for the state of Oregon.
And Mitch was what in the government?
Mitch was the state representative from Northwest Portland. He was the chair of the House Health Care Committee, probably the most influential person in the Oregon State Legislature in matters of health care. He's a remarkable man. He was the, I believe, chair of the Kaiser Permanente Research Division for years. He had this vision that this Hope Amendment would pass the legislature, go to the voters, And then the Oregon legislature would have to find a way to create a universal health care plan for the entire state. They'd be obligated to do that.
Mm-hmm.
So planning ahead, he created the Universal Access to Health Care Work Group, whose charge was to design ways to create universal care in Oregon with minimal disruption and insulated from the vagaries of the federal government.
And what year was this?
This started in January of last year. 1 year ago is when we first met.
Mm-hmm.
Now, after we met, this bill was defeated, went nowhere. So now we're a committee without a cause. What are we going to do? We persisted. We looked, in spite of the fact that the legislature now is under no obligation to create a universal health care plan for Oregon. We persisted. And we looked at all different ways that we could improve access to health care in Oregon.
And it was stuck.
We knew that no one had to read this report. If this Hope Amendment had passed, everyone would be reading it because it would be the guidelines
Yes.
for a new era in health care in Oregon. So we knew that we had a limited audience. We persisted. This group was interesting. Yeah, I haven't seen a group like this ever before in Oregon. We started out with 15 people. There were 3 state legislators. The chair was Andrea Salinas of the House Health Care Committee, Representative Barbara Smith Warner, and Representative Rich Vial, also of the House Health Care Committee. 2 Democrats, 1 Republican. And we had a representative from CCO, Big Business, Hospital Association, Insurance, professional organizations, hospital organizations, and a couple screwball critics like me.
Who pulled this group together? Who chose the members of the group?
It was Mitch Greenlick, Representative Mitch Greenlick,
Mm-hmm.
and it was Chair Andrea Salinas who had to run herd on this mixed crew. Probably the most remarkable part about this committee was the civility and dedication of the people on this committee. You'd think that with all of these different viewpoints, it would be polarizing, people would be obstructionist, people would be advocating exclusively for the interests of the people they represented.
So they were that dedicated.
It was a truly nonpartisan group, and we don't take that for granted nowadays.
Yeah.
The report can be found now online if you go at the House Health Care Committee and on the website of Representative Andrea Salinas. I'm going to plug that viewers actually look at the report before I tell you more about it.
Of course, yeah, and I'll make you say it again.
Go to the Oregon State Legislature website. Go to the website of Representative Andrea Salinas and Healthcare Work Group, and you'll find the report.
Healthcare Work Group.
Yes. What was interesting about the group were what we couldn't say. We could not advocate for any specific policy.
Because you're nonpartisan.
Not only that, because our charge was to provide minimal disruption of our current system. And what we discovered is our current system, correct, it is not designed for universal care. You cannot make our system into a universal care system without complete renovation. The foundation will not support it. No universal care systems work around the world. As a matter of fact, you go to any nation where you can still drink the water and you'll find a universal care system.
Why is it wouldn't work in Oregon or in the U.S.?
In Oregon, as in most states, 90% of the healthcare spending is governed by a federal law of some sort, which means Oregon doesn't have the discretion to rearrange how we spend healthcare. We would need waivers for Medicaid dollars. We'd need waivers for Medicare. In all of its nearly 60-year history, Medicare has only had one waiver granted. That was 1974. We would need waivers from the Affordable Care Act. Very few have been granted. And we would need waivers from ERISA. That's the acronym for the Employee Retirement Income Security Act of 1974. It was basically a federal law that said states can't touch health care benefits offered by businesses. That's a federal concern.
You're going to start at Washington, D.C.?
Washington, D.C. has handcuffed Oregon. We simply cannot combine all of the healthcare dollars that we need that's being spent in Oregon and redistribute them in an equitable and efficient manner.
So why has Washington, D.C. done that? What are the reasons?
This is the law of unintended consequences. There was no deliberate attempt by Congress to screw up states that wanted to create their own efficient healthcare systems. It just happened, and Congress has not taken any action to remedy that. Now, there is one bill in Congress, for those who want to know, H.R. 6097, the Universal Health Care Act of 2018, submitted by Congresswoman Pramila Jayapal of Washington. If that bill were to pass Congress, the Secretary of Health and Human Services could grant a waiver to Oregon saying, if you can prove that you can provide the same care to the same number of people without any more federal dollars, you can do whatever you want with your healthcare dollars. It would require action like that before Oregon could move forward. Another obstacle is that there are a few healthcare systems in the U.S. that seem to be working pretty well, notably Medicare, and a few self-funded plans by large businesses.
Mm-hmm.
These people, not inappropriately, want to protect that.
There is the fly in the ointment.
The buzzard in the ointment, yes. The only way to provide health care to people who don't have it yet is to change how people who do get health care get theirs. We all have to move together. We cannot add on one more system after system. You can't leap across a chasm in small steps. The whole thing has to change.
Are you some sort of a closet socialist?
This is an interesting term, Don. Universal care is provided even in nations that aren't socialist. You don't have to be a socialist to want to implement or to enjoy universal health care. There are countries that have created universal health care systems using private health insurance. All of Central Europe, France, Germany, Switzerland, these are all privately paid. Japan, privately paid. And in all of those countries, the care is privately paid.
These countries aren't socialist.
That's right. Now, if you want to go socialist, you can. But even so, single payer in which the government pays for everything but all the practitioners are private, is also universal, including in nations that aren't socialist, Australia and New Zealand, all the Scandinavian countries, Italy, Spain, Southern Europe. If you really want to look for socialized medicine, where the government pays for everything and everyone who cares for you is a government employees, there's only 2 places in the world where you will find that. One is Cuba.
Socialist, see?
There you go. And your healthcare system, the VA. The VA is the only example in the industrialized world where taxpayers pay for everything and government employees provide the care.
If Trump gets a second term, he's going to abolish the VA.
Unhappily, we have Congress people who believe that the VA should be privatized, which would destroy the most efficient healthcare system in the United States.
What are we going to do about that?
Vote smart.
Huh?
You got to vote smart. Here in Oregon, most of our congressional delegation is not in favor of undoing the VA, for which we should be grateful. When we look around the United States at all the different ways of insuring health care, we can look at private insurance, we can look at Medicare, we can look at Medicaid, we can look at individual policies, self-funded plans. The Veterans Administration healthcare system takes care of America's sickest patients with the best outcomes at the lowest cost with the highest patient satisfaction. And even today, that's still true. All of the tribulations of the VA simply corroborate that if you starve a healthcare system of money, it will fail. In the last 15 years, the VA has seen about 2 million new patients, nearly a 20% increase in patient load,
Yes.
with almost no increase in funding.
With the wars going on in the Middle East.
That's right. These are veterans of Afghanistan and Iraq who are flooding the VA, and the VA only has room for so many patients until it gets more money. Congress, in its infinite befuddlement, has said, we're not going to give more money to the VA, we're going to give a whole lot more money to disassemble the VA and turn it into a private system.
Does greed go that far?
I don't think it's greed. I think it's ideological stupor. I believe that the people who want to disassemble the VA healthcare system want to do it as a symbol of deregulation, of taking apart the government.
Capitalism run amok.
I think it's worse than that. In the United States, we are at a low ebb of institutional trust. If you look at surveys around the country, nobody trusts anybody else. They don't trust the government, they don't trust corporations, they don't trust unions, they don't trust their church. The only institution in the U.S. that has a high trust level is the military. This government shutdown, the Trump base buys into the concept that the government does 2 terrible things. It takes their money in the form of taxes and regulates away jobs. So the idea of a government shutdown or a wall is a win-win situation for them. It's hard to sell people on the contributions that government makes to their life. And in fact, for many of us, how dependent we are on a functioning government. When people don't make that connection, they celebrate the deterioration of very effective government systems, like the VA. That would be the last system I would take apart.
So privatizing would mean that you'd have corporations and crony capitalism run amok, and the monies available to run our government would be used for other purposes like the military?
If the VA, if money that's going to the VA gets diverted to private insurance, we will convert the health care that veterans enjoy now, the best in the United States, into a form that is the most expensive in the United States, which is individual private health insurance. You just can't pay more for health care than with that. So what we would see is, in an attempt to starve the VA of funds, because after all, the VA is government, it must be bad, we'd need to pour billions of dollars more into getting these veterans care outside the VA. It's investing in the wrong end. What is most efficient, and what our report found, is unity. Unity of healthcare. And if you go into another country, it doesn't matter who you are, you can see any physician. And it doesn't matter who your insurance is, your physician is going to be paid the same. It doesn't matter who you are, you have the same set of benefits. And no matter who you are, you're paying the same for your health care as everybody else in the country. It turns out that that efficiency is incredible. In the United States, 30% of our health care spending is just to get through the front door. There are so many people who are trying to stop us getting into the front door of a clinic or a doctor's office or a hospital that we spend 20% on insurance and another 10% on physician fees before we're spending any money on health care. With the United States, Oregon spends twice as much on administration. That is, people who provide no health care. They just make sure that you're in network. Twice as much as the second place competitor and 4 times as much as the average.
So who's getting the lion's share of that funding with the existing system?
All of this administrative friction is taken out in bites here and bites there. There's no line item for administration. But it's everywhere. Imagine going into any doctor's office in the country and you give them your health care card. And the physician takes it, she runs it through her card reader and says, okay, what can I do for you today? You have your exchange, prescription's written, thank you. You walk out, take your card with you, physician gets paid, you don't get a bill because you've already prepaid it, and that's it. There aren't 4 people in the front office who are looking at computer screens, looking through files, on the telephone, and then saying, doctor, you're going to have to stop what you're doing and talk to the insurance company for prior authorization.
Look at the people who you're going to take their jobs away if you follow your suggestion. Don't you care about fellow human beings earning a living?
That's a good point. So let's talk about what's going to happen when everybody gets health care. All of a sudden, there's going to be tens of thousands of people in Oregon needing health care. The demand for health care will go up.
Sure.
And not just physicians. We're talking about everybody who's associated with a hospital. People in the cafeteria, housekeepers, people who build the hospitals, parking lot attendants. It's been estimated that if the United States went to a universal health care system, we would create 3 times as many new jobs in care and in taking care of people as are lost in insurance and billing. 3 times. So let's suppose Oregon could pass a universal health care law.
Just for the state of Oregon.
Just for the state of Oregon. Every 2 years, State Senator Michael Dembrow submits his single-payer bill, and it has packed into it retraining. Costs of retraining people who are put out of work. So let's suppose Oregon goes to single-payer, and I'm a hospital biller. Now I'm out of work. Well, now I'm looking for work in a market that has 3 times as many jobs as there are people out of work and looking for them. I get retrained for one of those jobs, and while I'm getting retrained and while I'm looking for a job, I and my family get health care. Now that's, if you're going to re-engineer the largest industry in the state, that's about as soft a landing as you could hope for. We come out ahead with universal care.
You know, to dream the impossible dream, Sam.
It's people like you who keep the dream alive and move it a little closer to reality. When you talk about it, when you let people know we can do better, it doesn't have to be that way. We gain a couple votes here and there. People are willing to say, I'll let go of the crummy health care I have now and embrace one that provides security for my family. People are scared. They don't want to let go.
Because they're being brainwashed or conditioned to accept the system because there's not a responsibility that the media should be assuming to inform the citizenry objectively about the realities of what's going on and why it is they're having such a hard time getting health care today.
I'm not sure that it's brainwashing as much as fear, shame, and lack of imagination. People are fearful that their families aren't going to get the health care they need when they need it, right now. And what little access they have, they want to protect. That's the fear. They want to change. They're ashamed because we look around us and we see wealthy people, they get health care. I don't. Maybe it's my fault. I can't take care of my family. Maybe there's something wrong with me, not what's wrong with the system. And lack of imagination. Most Americans have never seen a working healthcare system. They don't know it can be better. They haven't been to England. They haven't been to Germany. They haven't been to Belgium, Holland. They haven't been anywhere across Canada. They haven't been to Japan. They haven't been to Taiwan. They haven't been to Korea. They haven't been anywhere that has a working healthcare system. So they just can't even believe it can be done.
They don't believe it can be done because they're being conditioned. Again, the media is not assuming its responsibility, so that they're not able to make a rational decision about getting health care on a universal basis. What do we do? Capitalism, is that what's going on?
I think you'll find self-interest around the world.
Greed.
In every healthcare system, especially in ours, there are businesses and people who have succeeded in making it work for them. The healthcare systems, insurance companies, physicians, unions, they're all somehow or other making this system work for them. And all of them have some interest in keeping this familiar system. If we start breaking this up and reassembling it, everybody's going to have to scramble for their share again. People don't want to do that. I think they should.
Greed, insecurity.
Mostly insecurity.
I'm coming back again for the third time to capitalism and the irresponsibility of the sources of information that people, of truth, of reality, that people can weigh objectively. You can tell I'm a democratic socialist.
In healthcare, that's legitimate. If we're talking flat screen televisions or telephones or iPads or consumer goods, capitalism does a pretty good job of letting people profit by selling things to each other. But healthcare is not a consumable good. It doesn't obey the law of supply and demand. As healthcare costs go up, our need for healthcare doesn't change. We cannot afford to shop for healthcare when we need it, especially when we don't know when we're going to need it. It's not a give and take. Healthcare to work needs to be treated like a public utility. We don't have companies competing to pipe fresh drinking water into our homes. And we don't want that. We want to take it for granted that we pay a price and we get clean drinking water. And that's the way it is with healthcare. We can't throttle back. If I get my pink slip, I've just been furloughed because the government is shut down and I don't have any access to health care. I can't tell my wife, all right, for 2 weeks don't get a cancer. I can't tell my son, don't get into a driving accident. I can't tell my brother, don't have your heart attack in the next 2 weeks. I can't say, don't fall out of a tree. We don't have control over that. We can't modulate that.
Hopefully we can find a way to get the money out of the existing system so that people can have rational decisions about the kind of systems you're talking about. And I've read the books, and a few of the books about the successes. Like in Japan comes to mind. It's so simple of all. And it's successful. And it's not destroying the economy, the economic system of those particular countries.
You're absolutely right. The key word in other healthcare systems, successful healthcare systems, is simplicity. That's what makes them efficient.
Simplicity.
Right. It's not like the doctors over there are any smarter, or they come up with their diagnoses any faster than we do, or people don't get care. It's just the administrative simplicity frees up so much money for more care. That's what we lack here. Now, just to let you know about the complexity of our system, the American healthcare industry it's not just the largest industry in Oregon or the largest industry in the United States. It's the largest industry in the world. Americans spend more in their healthcare industry than twice the gross domestic product of Russia. We spend more on healthcare than the Saudi Arabians get for all of their oil products. The American healthcare industry is the largest industry ever. For all we know, it's the largest industry in the galaxy. It's huge.
So it doesn't matter who's running the show in Washington, from what I'm hearing from you, whether it's Democrats or Republicans, we don't have a change from the existing healthcare system, not in the near future.
It won't happen unless people like us keep agitating. One is we need this federal enabling legislation like the H.R. 6097 so that Oregon can go its own way. And then Oregon needs to take action, and it needs to change everything simultaneously. We can't do this bit by bit by bit.
Oh, simultaneously, all that stuff?
Yes.
Ooh.
Because if we change just one portion, the rest of the portion is going to change to adapt to it. No, it's like in the military. You don't volunteer for anything. You don't want to be the first to do anything. You don't say, who wants to be the first person onto the beach and wait for somebody to volunteer? No. You say, we're all going. And you know what? When everybody moves, it works. Another analogy. Healthcare is like hunting mastodons. Let's go back to caveman days. We got all of these cavemen with spears, and they've all got hungry families, and there's all these mastodons out there, massive elephants. Plenty of food for everybody. So the tribe says, all right, all of you guys, take your spear and go your own way. Each of you has to come back with your own mastodon. Well, nobody gets a mastodon. A couple of them get trampled, and all the families go hungry. And then the chief says, all right, we're going to do it differently. We're all going to work together. And we're all going to go hunt one mastodon together in a coordinated fashion. And they get their mastodon, nobody gets trampled, all their families get fed. That's how we do it. But you have to get everybody to work together.
So?
You need leadership. You need someone in charge to say, this is the way we're going to do it.
If that someone is reasonable and pretty well thought out, then someone will take this one out and eliminate it. History is replete with examples of that kind of assassination.
We also have examples of leaders. Leaders who do the right thing and generate enough trust that enough people believe that they're doing the right thing.
And how long do they last? And this is getting down in the mouth here a little bit, and I'm going to stop pursuing this argument.
Fair enough. Let's go back to healthcare.
Okay.
In order for a healthcare system to work, everyone has to participate. You know, what does universal healthcare mean? It means everybody participates in the prepaid plan. That's how it works all around the world. Nobody is excluded, but no one can opt out. And for the most part, it's all prepaid. That is, you pay your premiums, you pay your taxes up front. When you get sick, you're not penalized by coughing up a deductible.
How do you incorporate that on a state level?
It would be challenging the way it is today, because you have to hear the other two features of universal care to make it work. You can't have people just buy skinny insurance that leaves them out to dry. In order to work, every policy has to be comprehensive.
Mm-hmm.
Comprehensive doesn't mean unlimited. It means treatable conditions are treated. So this comprehensive policy says, you've got a treatable condition, we'll treat it. Now you might not get the latest treatment or the most expensive treatment or an experimental treatment, but you will get treated. If you want to buy more, you can buy more. But you can't save money and pay less.
That's the rub. If you want to buy more, if it's universal, then you don't need to buy more.
Every universal care system in the world has a comprehensive plan, and anybody who wants to pay more money for things that aren't in the comprehensive plan, a private hotel room, unapproved treatments, experimental drugs, you can buy a supplemental insurance and get that. Nobody is prevented from spending more money on health care.
Well, the basic plan, a system, would it be adequate to take care of your average citizen?
That's the whole purpose, yes. You don't want to design a universal care plan that lets people die of treatable diseases. No country does that. If you get a treatable condition in any other industrialized country, you get treatment, except in the U.S.
I'm trying to try this on.
Okay, one more non-U.S. factor.
Sure.
It's all one network. Any patient can see any physician. And as a physician, I get paid the same no matter who you are. So I'm a primary care physician. I go out to my waiting room. I don't say, you've got tattoos, you're not going to pay much. You've got pearls, I'll take you. Every patient is a paying patient. There's no financial reason to shunt care to somebody else. So single risk pool, we're all in it together. Single set of benefits, single network. There's the simplicity. That's how it works. And that's what Oregon would need to do.
Capitalism will overrule all your logic and common sense because I'm tired of arguing this.
Well, I'll concede the point. In healthcare, there's really no place for capitalism. Capitalism works when private investors can profit from providing goods and services that people want efficiently. But that's not going to work where people need health care, and if they don't get it, they die. That model just does not, capitalism does not work in healthcare. Let's go back to clean drinking water for a minute.
Sure.
There are folk who say, if anybody can go get health care whenever they want, it's like a food buffet. People say, I've prepaid, I'm just going to pile up as much as I can, and we'll break the system. People will demand health care and will go broke. And that's sort of true in other industrialized countries where there's almost no impediment to seeing your physician. There are no deductibles, very little copays. People do see their physicians more frequently than we do. And they spend more days in the hospital than we do. But they spend half as much, and they're healthier than we are. What's happening? Well, after you've had one colonoscopy, you don't say, they're free. I think I'm going to have 4 more this month.
Sam.
People don't say, I'm feeling fine, but if it's free, I'll take one of those coronary artery bypass grafting operations. And while you're at it, why don't you take out one of my kidneys too? That's not how people behave. It's like clean drinking water. We all have a need, just like healthcare, for clean drinking water. Varies from day to day, varies from person to person. But if we don't get it, we die.
I have a solution. Wealth management system on a national level. Wealth management and what that means. Any human being on the face of the earth, somehow or other we have information about the amount of wealth they have and what they're doing with their wealth, and that they're not allowed to use their wealth to control other human beings and dominate the entire system because they're wealthy beyond what their needs are. Wealth control, wealth management, that's the answer. That supersedes capitalism or socialism or whatever. Gotcha.
I advise against using healthcare as a tool for social engineering.
Mm-hmm.
Healthcare stands on its own.
Not if I cut you off, sorry about that.
No. We see universal health care in every other industrialized country.
Mm-hmm.
These are people who get better care to more people for less money. And they all have wealthy people in it. And some of them have income inequality. Not as much as we do. We're the worst. But even in places that have vast amounts of income inequality, they still get better care to more people for less money simply by using universal care.
Sam, I think we're running out of time. And I could go on like this for ever and ever, and I'm not going to win, but I enjoy fighting with you about it. So anyhow, it looks like it's about time for us to sign off now, but let's talk about, you say a few words to that camera right there. You have about a minute.
Thank you.
To the viewers.
Learn who your state representative and your state senator are. Introduce yourself. Say, I'm one of your constituents. I think our healthcare system is a failure. I want my family to have access to healthcare no matter how hired, fired, retired, or expired I become. And I want you to make it happen. Sincerely, your voting constituent. P.S. Let's have coffee and tell me how you're going to do it. Relentless pressure like that, Oregon will get where it needs to go, and you'll be responsible. Never doubt the power of this weapon of mass destruction. This simple pen, if used to write that letter, can change the world.
Sam, you did it again. Yeah. Oh man, I think we're out of time now. And please remember KFC. Not Kentucky Fried Chicken, Dr. Don's KFC. Thanks for watching. Remember KFC. Not Kentucky Fried Chicken, Dr. Don's KFC. Kind, friendly, and charitable. Be kind, be friendly, and be charitable. To you too, and you in the control room, and you. Sam, thank you so much.
Thank you, Don. Pleasure.
Thank you.